Why did you choose medicine?
I didn't have that much confidence that maybe, 15 years from today,
What do you think were the cons of this branch?
medicine is really difficult to study.
बहुत toxicity है, seniors, tend to be little bit torturous. So is that a fact or a myth?
That happens wherever there is a big name of the institute.
What kind of mindset should a student have, should a medico have to actually succeed in this branch?
If you really love medicine, you should prepare yourself that I will learn throughout my life.
Giving doctors an SOP to get the maximum number of investigation, can we call it a hospital scam?
Actually, we can call it.
What is the pay scale, the salary of an MD medicine physician? We are building India's largest community of medicos. Thank you all for making Dr. Nachiket Bhatia Show a success. But I still have a complaint. 92% of you, our audience, have still not subscribed to the channel. So before we move forward, I would request each one of you to please press the bell icon and subscribe to the channel. So for today, we have a very special guest. The branch that he is representing has been in the demand with our audience for the last 6 months now. I would call it the most demanded branch, and it is obvious also. The branch which is called the most, the classic physician branch, I'm sure that you have guessed it by now. It is medicine. But we have kept a point in our mind. A student said, get a doctor who has just completed his postgrad so we can get a real-time scenario. How is the toxicity, the patient load, how much can a physician actually work in the department, the experience being a first year postgrad, a second year or a third year postgrad, whether the SR-ship market is actually in scarcity and there are no jobs available. We have got a special speaker for that. He's an educator, he is an influencer, and he is an MD medicine physician. I'm sure you must have guessed the name by now. He is Dr. Vishal Gabale. And Dr. Vishal is going to take us throughout the complete journey of being a medicine postgrad, a medicine resident, and of course in the future, he will be an upcoming medicine super specialist as well. So let's put our hands together and let's give a warm welcome to Dr. Vishal Gabale. So welcome Dr. Vishal to the Nachiket Bhatia Show.
Thank you so much, sir. First of all, congratulations on 50k subscribers on YouTube.
Thank you so much, my brother.
It's so helpful for all of us and we have learned so much through it. And I really wish you to cross 1 million very soon.
Thank you so much. So Vishal, one of the main reasons I have got you in the podcast is that you are an MD medicine who has recently graduated and you know the real-time structure, the real-time scenario, what is happening on ground. We are not going to talk about hypothetical, issues right now. We are going to talk about real life scenarios, what is happening. So before we got into that, I want to know the history of Dr. Vishal Gabale. How did you get into MBBS, then MD medicine? Why did you go ahead and choose it? And of course, what's the upcoming plan?
Thank you so much, sir. So, as starting from a small town, I was from Aurangabad. Started as a mediocre student, I was an average student, not very sharp. In my family, my brother was quite sharp, so everybody used to look up to him. And only thing that motivated me to get into the medical stream is to avoid comparison from him. So he took engineering, and at that point we had only two options, right? Either engineering, either medical. So he took engineering, so I had only one option. Let's take medicine and let's build our own fortune. So then I got into the 11th, 12th. So in 10th per se, I was not, as I said, I was a mediocre student. So studied well, got around 92% and got into a coaching institute. Again, I was lucky enough that even having an accident, I had a small trauma in 11th. That was an accident. I think that was like an eye opener for me. So after that event, some things change, and I think you need that kind of shock in your life to get realization that we are going in this direction. No, but this is not our destiny. I think we should go in this direction. So that helped me to go in the right way. And with that, I studied well in 11th, 12th. And in the first attempt, I got into the GMC Aurangabad and luckily got rank in just 1000. So after entering into the medicine, as you know, the path of MBBS is so overwhelming. entering into the first MBBS, everything looks like what we have done to ourselves. But just going ahead in the first, second, third, fourth, fifth year of MBBS, few things started unfolding. And that's when, in my first rotation of internship, I had posting in medicine, and I saw a very emotional story where there was an elder lady. So she was brought by a few people. She was homeless and she was unconscious, very cold. Everybody was shocked, like, what should we do now to her? Like, what exactly, where are his relatives? Who's going to help her? So at that point, one of our residents, I was as an intern, he diagnosed the patient with mixed edema coma. So we managed with the thyroid injection and rewarming, etc. And she completely got better. And she even started recalling. And the sad part was she was put into the old age home by her son and all. But I think that gave me just a push that maybe medicine is for me. Because if you can change this much to the person with just correct diagnosis in very short span of time, and medicine is something which has depth in it. So if you love subject from the core of your heart, I think then medicine is for you. So that triggered me that maybe medicine, I should take it. And that's why I did medicine.
Let's talk about medicine, Vishal.
Yeah.
When you were on your PG prep, so you must be thinking ki which branch should I choose when I cross PG. When you cross your PG, need PG exam, you had your choices. You had a very good rank. Why did you choose medicine?
So first thing, as I said, Dharma, radiology, these were the other two choices I had, and surgery also. So I actually skipped the surgery because, as I said, that I had a trauma in the 11th. So after that, I developed essential tremor, and not after that, but I would say that developed me some kind of anxiety when I used to see a lot of blood or maybe surgical procedures. So I didn't have that much confidence that maybe 15 years from today, if I go into the practice and my hands are trembling like this, then 15 years ahead of this patient will not believe in me that will this guy really gonna go do really good surgery or not. Then I thought maybe pediatrics is a good choice, but my parents said obviously they had influence, so they said better peds. There are less number of patients. Go for medicine. And as I said, that I wanted that from that patient of Hashimoto. I learned that really medicine can change few things if you are good enough or good clinician. Even we used to see house MD and all, that glamorized the medicine for me. So I thought, let's go ahead with the medicine. Then I chose medicine, and I think medicine really takes toll of your life. Many people say that medicine is a fallback. For me, I think from my point of view, medicine is a launch pad. Basically, it helps you to launch. If you do MD medicine, you have so many several options. Either you can do starting from neurology, cardiology, gastroenterology, even rheumatology, endocrinology, nephrology, even MD in genetics recently. So these all possibilities, even oncology, critical medicine. So there are so many options if you do MD in medicine. So that's what said that maybe I should go for this. And if you want to do something more super specialized in life, maybe we can choose something else. So that possibilities are always open. So that's why I think medicine.
What do you think were the cons of this branch?
First thing first, medicine is really difficult to study. You have to read n number of books, n number of resources, guidelines keeps on changing. So that's a really tough task. If you want to be a clinician, a very good clinician, you have to learn throughout your life. That learning never stops, either as a surgeon or even orthopedician. You know that if you learn some procedures, if you do fellowships, you keep on doing those surgeries throughout your life. Or maybe some things changed, then you can acclimatize to that procedure and you can do again that procedure for next 10 years. But for medicine, you have to constantly keep on learning, guidelines changes, all the things are keep on changing. So I think that's a tough task. Second thing, work-life balance also matters. In medicine, if you are just plain MD medicine, you have to work for longer hours. You have to see lot number of patients than the DM or even surgeons sees. So to just get that much amount of the financial outcome, you have to work more as MD medicine. That's what I feel. But yes, again, if you really love medicine from the core, then you should not look at the cons, right? Because everything has this own side effects or disadvantages.
I mean, if I talk about a student's mindset, what kind of mindset should a student have, should a medico have to actually succeed in this branch?
So first of all, as I said, if you really love medicine, you should prepare yourself that I will learn throughout my life. the learning will never stop in my life and I'm passionate about this. Second thing, I'm not glamorizing the things. I'm not a person who likes the glamour. Either it's dermatology, orthopedician, fancy parties and fancy enjoying everything and all. But if you're doing medicine, you have to obviously dedicate more time to the patients. Either it is outpatient, then you again have inpatients, you have ICUs, maybe you have references from your pediatrics or even OBGY per se. So it becomes difficult to be a medicine. Second thing, if you want to do medicine as a medico, you should have that person, you should have that character for problem solving. Because medicinal personality per se is someone who loves to solve the complexity, right? Because it's not simple. You have to do n number of investigation to diagnose the case, and even after that, you don't know anything. You're just hitting in the blind spot. Let's hoping for a good thing, and eventually you see the result depending on the patient response. So most of the time things go out of your hand. So you should be someone who want to pursue that complexity. So that two thing I think should be there. Third thing, you should not be a person who gets easily tired because residency is too hectic, at least in the first year. And fourth thing I would say is you should be happy to do DM in current scenario, because I think DM is the last resort, as you also said few minutes back to me. So I think yes, 4 points you have to know this.
It's called a very toxic branch. I've heard a lot of instances where students basically gave up in the first year itself कि नहीं हो पा रहा, बहुत toxicity है, seniors tend to be little bit torturous, so and professors do not help out. So is that a fact or a myth?
So that's very, very important fact that happens, and I think that happens wherever there is a big name of the institute. I would say big name is because they have a lot of patients, and when you have a lot of patients, there is obviously toxicity, and professor don't care because they have studied throughout their life and they have got to this stage now, and now at this point of time they don't want to listen anyone's problems, right? They're already got into so much of chaos in their life. So talking about the seniors, they're also frustrated because first year they have seen lots of patients, and in second year they are entering into second year, and then they again had to do the job of the first year because first year are not competent enough. I'm not saying that all the seniors are like that and all the juniors are like that, but if some juniors are not doing their work sincerely, because as we are going ahead, we are seeing the generations of the first year residents who are more reluctant to do jobs. So they just want easy escape, I would say. They will feel like, why I'm doing this mama work, sampling ECGs, this is not my job and all. They're coming from Gen Z background, so that becomes really difficult for the seniors to acclimatize. So because of that toxicity is there. But yes, toxicity should not be there, but that's kind of ideal scenario that will be always there. Considering the huge number of the patients in Indian scenario, I think it's very difficult to minimize the toxicity. So yes, toxicity is there, but what junior residents should do, that I'll tell now. Because for junior residents to cope up with the toxicity is very important. What used to happen in my residency, my senior was quite toxic, even my HOU. So what I used to do is I used to be a little more sincere, see lots of patients, and note down what exactly their question gonna ask me. I used to note that down, do my proper homework, and I used to think one step ahead of them. But not doing that, I just used to think about that, because again you do extra step, then your consultant and again he used to get pissed. So you just have to think ahead. When he asks the question, you tell the answer. If he asks your senior, never tell answer. Otherwise then senior gets pissed at you. So just think of it, take all the possibilities, do proper reporting to the seniors, and take minimum amount of the leaves. I've taken good amount of the leaves because I was in DNB, so we had proper leaves. But if you can take minimum amount of the leaves in the first year of residency, try to keep everyone happy. Because particularly in case of MD residency, you have to take care of your seniors, you have to take care of your guides, because the passing and all is dependent on them. If you are doing a DNB, then don't care about anybody. Just do what you feel sincerely, and the institution should feel proud of you. That's what. But if senior is toxic, don't care about them, because DNB, the senior's impact is very less. So that used to happen with me, and I think this is why maintaining your mental health, maintaining your strong mindset and your perfection at your work will only help you to reduce that toxicity. Because people around us, we cannot be assured of, most of them will be good or kind. Most of them are bad, or most of them are pissed off in their own life. So they try to show, or they try to escape that on someone. So if you're good at work, if you're good at your work, then maybe you have a good chance to succeed in this toxic residency.
I think this branch also has the highest amount of ego amongst the residences.
Yeah.
Because this is the branch that makes you feel like a Dr. Sahab. And normally the first year when it moves to second year, suddenly becomes ki now I am the senior here, and tends to have a lot of ego, which they expect the new first year are going to come massage for a while. So what is your advice to a new first year resident of medicine? How to maintain this balance, maybe massage the senior's ego and make sure things are run peacefully?
So first thing, if your seniors are too much demanding, don't give what they want. That's very, very important thing of residency. If they are keep on asking on several things, if somebody is asking the job, it was given to them by their seniors, like for example collecting the reports or collecting the CT scan or seeing the references. If the seniors are implying things on you, don't do that. Directly go and complain from the day one itself. Don't complain in mid residency from the day when, because सीनियर्स विल फील अब तक तो कर रहा था, अब तक तो इसे कुछ नहीं लगा, पर अभी बीच में ही इसको क्यों प्रॉब्लम हो गई, लगता है इनमें कुछ हो गया. बट इफ़ यू फील दैट नाउ दिस इज गोना बी लाइक दिस ओनली, अगर सीनियर आपका ऐसे ही काम चोर है, आपके ऊपर सब डाल रहा है, टू बी ऑनेस्ट, देन यू हैव टू रेज योर वॉइस and complain about him. But if senior is good enough, he guides you in several occasions, ask for the help on few occasions, then you should be good enough and tell him. Senior should be, I would say, a friend, or friend rather than friend, a human being like any other. You should not treat yourself like an inferior person or something like that. If you want to do it like a friend, do some favor, get some favor. I think that should be the relation between junior and senior, and that will only help to develop that rapport. But if somebody is very toxic, considering your mental health, considering your own burnout, don't ignore this stuff. Take leave, complain to your HOD, complain to the dean, and just don't get drained into that daldal, I would say.
Normally, do HODs tend to listen to these complaints?
Sir, nowadays they are listening, because considering the mental health breakdown and very sadly the number of the suicides amongst the residents, number of the residents leaving the institutions, I think HODs are now very much serious about your mental health. So if you are really suffering from it, I think you should raise your voice, but please be very sincere about it. I've seen some students who just get easy escape in a name of mental health to have some fun in friend's wedding or brother's wedding. That should not be done. If you're really suffering from it, take a break, go at home, relax, do nothing, just spend time with family. And if your HOD is also not listening, then go without leave. Even if you get extension for 1 or 2 months, that doesn't matter. You can do that extension as a JR3, and right now you can just escape this situation, which is really toxic for you. Because for your family, you're the person who is the most important in whole world, right? And for you also, your family and yourself. So just believe, and I think focus on yourself. If someone is really damaging you from outside, someone is really harming you on your mental health, just don't listen, just go away and just relax at home. That's my opinion.
You're a person who has just graduated
Yeah.
a couple of years back.
Yeah.
So I can ask you this question, because otherwise it would have been a hypothetical scenario. So do you think the professors or the seniors take mental health issues seriously? Or is it just considered कि जा थोड़े देर सो ले, ठीक हो जाएगा, दारू पी ले, ठीक हो जाएगा? Or do they take it seriously?
No, sir. It's really sad to say in India, nobody takes mental health seriously. I have also came across few situations during residency, because we were in COVID era. So sadly, we saw so many deaths around us. It was really troublesome to see. Every day in ICU there used to 3 to 4 casualties, and we were all mentally drained at that point of time. And when we used to ask the break or at least 1 day leaves, our senior or the administration used to say that why you need a break, you're working for 8 hours only per day. In our time in residency, we used to work for 24 or 36 hours in a stretch. You guys only have 8 hours, 12 hours of duty. Then so this is definitely there, sir. They obviously ignore your mental preferences, but this has to be changed at one point of time. Talking about this scenario from the Western medicine, where they have like around 40 weeks 40 hours a week culture, in India it's close to 60 hours or 72 hours a week. So that becomes really difficult, and that's really drainful for the residents, and nobody takes it seriously. So at that point, again, as I said, if you really are drained and nobody is listening, go away, take break. Your mental health, your personal health, and you is the important person than anybody.
Which will you say are the top 5 most toxic institutes of our country?
So most toxic, according to me, with what I've heard about from students, so KEM most of all, Cyan is very toxic, BJ Ahmedabad, then I would say SMS. I've heard some incidences from there, and Kolkata Hajikar. So these are the worst institute, I would say. But yes, trends keeps on changing. Maybe if you're planning to get residency, ask the seniors over there. Not seniors, I would say, not residents. Ask the AP level professors, because senior residents will always say it's good, you should come here, because they also want someone to work under them. But if you really want to ask for the assistant professor. Then they'll only help you really.
This is a good parameter that you have given us as the AP, not the resident. All right, that's a good one.
Yes.
So tell me, what's the main difference between MD medicine and DNB medicine?
So as such, in the corporate, MD, DNB are considered same, because DNB was introduced moreover because they wanted to increase the number of the postgraduates in India. Earlier, we used to have MD only in the college setup, either government college or private college. But they tend to increase the seats of the postgraduates. So DNB was introduced, and DNB introduced particularly in the corporate setups. So the person who has done DNB has the idea about the corporate work, that how the things are there, how the insurance policies, how you have to treat the patient, what medications to be given, and all the guidelines, protocols are very well followed, and the number of the patients is also not that big. The variety can be there depending on the institution, variety of the cases. But if you go into the government colleges, you will see n number of the cases. So either if you're talking about the chronic liver disease, you will see 6 to 7 or 8 to 10 patients of ascites in one ward. When you go into the DNB, you will see only 1 to 2 patients of ascites. Similarly, if you're talking about the stroke, you will see 10 to 12 patients of stroke. And in DNB, only 1 to 2 patients of stroke. So variety can be there, but the number of the patients, and again, in DNB per se, the number of residents are also less. So the exposure, I think, doesn't change much. And talking about the passing now, in MD medicine, passing is slightly easier because you are at your home institution. Most of the times you get pampered by your HOD if you are good enough. And in case of DNB, nothing is in your professor's hand. You go into the different centers. So I had exam in Delhi only at Balaji Action Institute. So I knew nobody over there. I was absolutely, at blank that what's going to happen, what case I will get. But luckily, everyone was guru down. So dil walo ki dilli. So I luckily got through. But that's not the case with everybody. If you get exam in South India, South part of the India, it becomes difficult because they're not very helpful. And if you get cases which you have not seen in a recent past, or you're not able to reason properly, then maybe there's a high chance that you can fail in DNB as well. So passing is little difficult in DNB than MD, but currently, if you ask me, the passing percentage has gone very high in case of DNB also. But again, if you go for the job opportunity interviews, if you're coming from good MD college, medicine college from the good institution, they will prefer you more. And if you are coming from the DNB, even from the good college or average college, they'll prefer you less. But if the jobs are vacant, then there is no differentiation. And I think DNB is just a gateway. If you want to do DM anyway, either MD is going to do DM, DNB is going to do DM. So that's a good gateway. You don't have bonds in DNB. You have the equal amount of the pay. If you have the equal amount of the fees as well. So DNB can be chosen by them who really want to do DM. And if you really want to settle early, MD can be done from private institution if you have money. And if you don't have money, DNB is also good enough nowadays.
What are the super-speciality options after MD or DNB medicine?
The most preferred currently, I would say, is gastroenterology, endocrinology, because in gastroenterology, you have the interventions as well as you have the OPD practice, you have inpatients as well, good amount of the references.
DNB result is considered very low. It will always get a low result. What is the reason? Are the students not prepared? The teaching is not good? Or the whole examination system is rigged?
To be honest, examination system is not rigged. basically, because it's very well standardized exam. You have good amount of the questions. Yes, they are hectic, 4 days of exam continuously, as opposite to the MD exams, which are alternate days. Indian base, you have 4 exams, and the worst thing about that 4 papers, the syllabus distribution is not there. So in any paper they can ask anything. Literally in my exam, in the paper one we got the updates. So few updates were asked in the paper one, then we absolutely got devastated. Now how will we answer the next papers? But luckily they managed to balance the systems. So that's very difficult part about the DNB. You can't expect what the questions can be in the papers about the theory. But recently the theory passing rate has significantly gone high. Talking about the vivas, as I mentioned, for practicals you have to travel to the other centers, where obviously you don't have your godfather over there, and as opposed to the MDs, where you have your HOUs around you, your guides around you, basically who favors you. They know you. Even if the external examiners ask some difficult questions, they will try to cancel out that with the easier questions. But as opposite to that, in DNB you absolutely have to have that done that hard work, and really a knowledgeable person can go through that practical exams in DNB. So that's why examination system is not rigged. I would say teaching per se is not very well in DNB, because these are corporate hospitals. All the consultants are busy in their own practice. So teaching is not there. You have to learn through your own. But good thing about the NB is they take regular classes. So you can also learn through that classes and self-study. So these things only will help you. So that's why per se DNB has less passing, but now there is a positive shift as well. So depending on you, how much you study.
I heard this from someone that now corporates, especially in metropolitan, are preferring DNB over MD.
Yeah, that's true. In many hospitals, actually, the reason behind that I will tell you, and that's a shocking reason. First thing, DNB students are very well trained in the corporate setup. So they know how the corporate mindset works. They know that how the corporate people need more and more investigations. Really, I'm saying it to the fact to this, because if you work in the corporate, many hospitals are there who just want to do n number of investigations. Okay, because patient has insurance. Okay, it depends on the doctor again. If doctor is good, has good mindset, he might not do many investigations. But most of the corporate people, big hospital chains, they have trained and they have given SOPs to the doctors like that you have to do all the possible investigations. Obviously guidelines definitely say that all the investigation should be done, but as a physician you have your own brain, right? You don't need all investigation to really narrow down the diagnosis. But the corporate says do as much investigation as you can do, give multiple antibiotics, give multiple treatment. That's guideline are saying. And if you work in the government setup, you're treating the patient with whatever resources you have, right? So that's why when you go into the corporate after doing MD or a DNB, as a DNB physician, you have more insight of what they want. So that's why they are preferring more DNB. That's my honest opinion. But talking about the rest thing, as a DNB, you have good communication than the counterparts MD, because MDs are working in the government setup. There are lots of patients. They might not be able to convey their message in a proper communication to this population. But opposite to the DNB, they have like few number of the patients, and their communication skills, everything, approach develops very well. So maybe that could be the reason why DNBs are preferred more in some metropolitan hospitals, not all.
So, can we say this scheme of corporate hospitals giving doctors an SOP to get the maximum number of investigation, can we call it a hospital scam?
Actually, we can call it hospital scam, and it's not new. I've seen since the time when I got accident in 11th. So there were so many investigations done, and obviously at that point maybe I didn't know. So was they really necessary or not? But recently I have seen some in some hospitals where few investigations unnecessarily was done. And like for example, if patient is coming to health checkup, just routine health checkup, uh, that's according to the guidelines, right? So why you need like lipid profile, why you need treadmill test for the normal persons, just or health checkup, right? You can just assess some basic investigation, CBC, etc., auscultation, echo. That's it. Why you would need TMT? Why you would need stress test or dopamine stress test, etc., etc. So these few investigations are unnecessarily applied on few patients, but it's not everywhere. But yes, there are obviously few people or few corporates who works in that way, and really sad to say that, but I think that's not very much.
Don't you think it leads to basically general public questioning even the ethics of good doctors because of these practices?
Exactly, that harms in a larger population, because not many doctors are like this. Not many doctors, or most of the doctors have taken, or like everyone has taken Hippocratic oath, but most of them follow that, right? 99.99%. But there are people who actually are money oriented. Maybe either there could be a number of reasons for that, or the hospital policies would be like that. But sometimes I think it's depend on the doctor, how kind are they and how their approach is. So if as a doctor I'm saying I can say to the hospital, I don't want this investigation. If you don't want this patient R&B, shift to the other doctor. I would not investigate if you don't want to go through my way, because my guide used to say that my patient, I will follow the all the things as per I want. You cannot tell me what I want to do or what investigations I should ask for these patients. So if it's up to you, if you are kind enough, then nobody can force you.
Do corporates also offer bonuses to doctors who have done the maximum number of revenue in their department?
That's actually the part I'm not came across yet, but I guess there can be some sort of remuneration, because if hospital is getting profited with you, obviously you'll get some reward.
So let's talk about the future of medicine.
Yeah.
Post MD and DNB medicine, what are the super speciality possible after these branches?
So considering the DM as an option, we have gastroenterology. That's the in the highest demand right now, because you have procedures, you have even practice, OPD practice, as well as inpatients are there. Good amount of references is also there. So gastroenterology is very well, and you get good amount of satisfaction as well, because patient can get better quickly. In like Unlike if it's CLD or ascites or any chronic liver diseases, that becomes difficult to manage. Then coming to the cardiology, it's very high yielding or high earning. You can do procedures, you can have good OPD, good outpatient as well as inpatient departments. Then endocrinology is really booming, considering the obesity and the metabolic syndrome profile of India, even NFLDs. So that's very good branch to look up to. Then nephrology, neurology, these are always there. Hematology, oncology, little low, because there are not many patients as well as not many doctors also. So if you're really passionate about this branch, you can take hemat or onco. Rheumatology, again, very few doctors and very few seats as well. So if you're getting rheumatology at good institution, there are only few institution available for the rheumat. So if you're getting it, I think rheumat also is very good branch.
What do you think is the future of this branch, considering how AI is taking over? What will be the role of AI in the branch of medicine post 10 years?
I think AI will really help in diagnosing. AI will help us to narrow down the actual symptoms or actual investigations. As I said, that there are few unnecessary investigation which we have to do now, either because of suspecting some DDs and all. Obviously, our brain works so smart than the AI, but in future we never know if AI can diagnose or directly do the CT scan, X-rays. Just with the scanning machine. I saw that NVIDIA's new device, right? You can just stand in that machine and you get all the ideas about that, and that uses low dose CT scan, not even the high standard dose CT scan. So this kind of discoveries will really, I think, change the perspective about treatment. So in treatment, you will get really good help, but how to treat, when to treat, what medications to give, that has to be individualized. And I think AI will not be able to do that much as a physician can do. So medicine cannot be replaced by AI. Yes, it will be assisted in good amount, and it will also reduce the paperwork. It will reduce the collecting the data, storing the information, maybe making correct choices for large number of the patients. So it's an supplementary rather than complementary.
Can you list down top 5 institutes of MD and DNB medicine in our country?
From my perception, in India, the Gangaram is good. Saint
So we're
Stephen.
talking about DNB first.
Yeah, first I'm talking about DNB. So starting with Hinduja, because I'm from Mumbai. Then Gangaram, Saint Stephen is good. Dinanath Mangeshkar is good. In Hyderabad, we have good institute, that is CARE. Even in Bangalore, there are good institutes like Bangalore Baptist. Even St. Mary's, etc. So there are so many good institutes in DNB, and mostly in DNBs you will get into the good colleges only because it's available in the metros and the professors are already interested. Otherwise, there is no DNB in the corporate if professors are not interested. So you get good academics overall. But if you go into the periphery, now periphery also has DNBs, so that can be little tough because academics are not good there.
What about MD medicine?
MD medicine, as we said, it can be little toxic, but the choices will never replace that. So first is MAMC, second is SMS Jaipur, BJ Ahmedabad, KM, even Nair is good. It gives good work-life balance. Then JJ Sion, good in Mumbai. And then if you go to the Kerala also, the GMC colleges in Kerala are good. Also same applies with the most of the GMC colleges are average and good enough for the MD medicine.
So now I'll ask you the most demanded question of our podcasts, which is what is the pay scale, the salary of an MD medicine physician immediately after his postgrad, 10 years down the line, 20 years down the line?
Immediately after the MD medicine residency, as a SR, if you're working in Mumbai, you get at least 80,000 to 1 lakh rupees. That's very less. To be honest, that's a shame. And if you're working in Delhi, you can get up to 1.2 lakh to 1.5 lakhs. But again, if you go to the corporate, you can get up to 1.5 to 2 lakhs as well. That's in the starting phase, I'm saying. And if you are going to the periphery in the starting stage as well, and you are very well confident, you are able to manage the ICU procedures very well, then you can, like I was offered around 2.5 to 3 lakhs in the rural setup or in the remote setup. But I was not satisfied with that. Obviously, when you do MD, you want to stay at like good cities to get good work-life balances and good enjoyment and etc. So that's the thing after the medicine residency. So after 5 years of MD medicine residency, I think if you're practicing as a physician, you will have a good amount of the OPD, at least around 50 to 70 OPD per day. That even if you take 500 rupees from per person, that's like 35,000 per day. And if you're having inpatients as well, so that again gives you good amount of income. And if you're also attached to the corporate hospital, that will give you fixed salary. So roughly, I would say around 8 lakhs over a period of 5 years, you can earn as a physician 8 to 10 lakhs if you're working really hard. And if you're again 20 years ahead, maybe you have very well established ICU now, you are a senior consultant, you are charging 1,000 rupees now, and you have OPDs of 50. So that goes till 15 lakhs.
And what about 20 years later?
20 years later, again, maybe 20 lakhs.
So normally people say that now in metropolitan cities, branches like medicine, dermatology are saturated. There are no jobs available. SRship, post SRship, there's nothing available. Did you face that kind of saturation there?
For medicine, I did not face that saturation because medicine is like most demanding branch. Everywhere there is a vacancy, and even if there is not vacancy, you can make one because it's a demanding branch. Talking about derma, if the hospital is occupied by 2 dermatologists, and most of the times you don't get that much patients in the corporates, most of the dermatologists who are well established have their own private practice. So people tend to go to them because, it's kind of moreover to the branding of the dermatologist. So yes, you can face that with the dermatology. With the OBGY, again, you won't get that because OBGY is also one of the demanding branch. So I would say derma radio is also little bit saturated, not very much saturated, but if you go and you want only in the premium institutes, then it's very rare that you have the vacancies because people like to stick to that college because they are getting good salary, good exposure, and it's close to their workplace or home place.
So what would your advice be to a new postgraduate who has just postgraduated and now he's looking for a job? Would you suggest that they should stay in a first tier city or should they find a job in a second tier city?
If you're just passed out from like good college or metropolitan city, depends on your preferences, like where you see yourself after 10 years, because you have now experienced both of the scenarios, either tier 2 city, tier 3 cities, or even tier 1 like metro cities. Then depending on you, what are your preferences? I would say if you are someone who likes chill, calm, and even a decent salary, maybe you can go to the tier 2, tier 3 places where you will earn up to 3 to 5 lakhs at starting also, depending on your practice, on how much work you want to do. And if you can scale that by setting up your own setup, your own hospital, you can go ahead at least the 10, 15 lakhs as we discussed. And now if you're someone who wants to enjoy the resources around you, who has a good family background, doesn't want to work much, maybe you can settle at around 1.5 to 2 lakh salary for few years. And if you have good family support, you can set up your own practice in the metros as well. But again, the earning is not as much as the tier 2, tier 3 cities. But if you are someone who wants to DM, and then maybe metros will help you more, because people don't have that much awareness about the super specialities in the tier 2, tier 3 cities. And in the metros, yes, we know now, even the meds know, right? Ki I want to go to the pet ka doctor, or etc, etc.
So, what are the best diplomas that are going on right now? Diplomas or fellowships? The most in demand ones.
In demand ones, the diabetology is never gonna end. Diabetology is number one. Second is about the non-interventional cardiology, because the number of the cardiology cases not gonna get down very soon, right? So non-interventional means you can do CT, coronary angiography, you can do echo of the patient, then you can do stress tests, etc., reportings and all you can do. That's very much demanding. Then again, recently considering the obesity cases, obesity is one. Then endocrinology like thyroid management, etc., that can be also one. Rheumatology fellowships are also in demand. Infectious disease and ICU. So these are few very highly demanded fellowships that you can consider. Even after MD, you want to set up your own practice and you don't want to do DM, you can do these fellowships.
There are a lot of NMC derecognized courses also, which are, I won't say derecognized, I would say courses which are not recognized by NMC. Do those courses also work?
Not really. Actually, there are so many institutions. We all know about those, right? Some are tied up with the Stanford, Harvard, and some are tied up with the Dubai hospitals, etc. Right? But in practice, nobody, even corporate hospital doesn't care about that, because these are the fellowships which you can really buy on yourself. And I'm not really sure about the credibility of those, that how much you really read it. Right, just period of 6 months, you just scroll down the things and you can get the certificates very easily. So not very sure about that, because I have not done that. But if you are really want to do, if you are someone who really want to do fellowships, I would suggest go to the institutions where there are in hospital practices are there. You have to stay at some place for 6 months to get fellowships in that particular subject you want, because if you want to be really expertise in that aspect, you can't learn all the way on internet or remotely.
What is the main difference that you would say between a government job and a corporate job?
To be honest, government job is the something which will give you a lot of headache, very few satisfaction, and lot of frustration. And when you go to the, because the number of the patients are there, right? Number of lots of patients are there, students are there, you're dealing with the students in and out. It looks very fun when you're going at the start. You're asked to take exams, you like it, you love it in the initial part of the your career. But if you're someone who really loves to teach, then government college is very good for you. But I'm talking about the general person who really is confused about corporate or government hospital, because government hospital jobs are easy to do, but that takes toll. And if you talk about the corporate is something which can kick you at any point of time. So you cannot rely on the corporate as well. If you really want to do work in the corporate, you should have your own practice first. If you have your own OPD of 50 patients, then only corporate will respect you. So if you want to just teach, you love that, work in the government hospital. And if you want to really earn well and join the corporate as well, so rather than that, you should start your OPDs first, get good amount of the patients in the OPD over a period of 2 years. All the corporates will run to you that please join our hospital, and they will never bother you. So that's the thing.
So make a backup first, then do a job.
Exactly.
This is what you're saying.
Yeah.
Well, let's talk about then clinics then, because a physician's main pride is that they have their own clinic.
Yeah.
Now, when is the best time for a postgrad to open his or her own clinic?
So first thing, many people feel after their MD residency that I'm not sufficient enough. Maybe I need to do SR-ship. Maybe I need to do some ICU fellowship. Maybe I need to do diabetology, etc. But I would suggest if you start early, it's not going to happen that on the day one, you're getting 50 patients to you. You're going to get few patients, right? And through that, if you really want to practice, right? If you really want to practice as MD physician, I think just finish your MD medicine, you get the degree, start your OPD right away if you have good setup. But if you have mandatory SR-ship, maybe you have to do SR-ship first. So if you're someone who doesn't have bond and you just want to practice as an MD physician, right away, just after your MD residency, start OPD. And while doing OPDs, you can do several fellowships if you don't want to do DM. So right away after your MD, I think.
Normally people are, especially young doctors are confused how to open up a clinic, because it's very easy to say let's open up a clinic.
Yep.
But the question is how, where, how much, okay, what is the staff that is required, and there are many other questions. So let's start with how to open up a clinic, where they should open up, and how much is normally required to open a physician's clinic.
So I would recommend this. First of all, when you're starting your OPD or when you're starting to build your own practice, try to make your name with the polyclinics first. Okay, so polyclinics are something like there is already a gynec clinician or there is already pediatrician sitting over there, dermatologists etc are there, and now they have a vacancy of a physician also. So you can go over there, because rather than with your name, even if you don't get any patients, you can get good amount of references, and from that you can build your own practice, right? And if you're not comfortable with the polyclinic, then you can see decent place with a good amount of the crowd. At least I would say there is always a physician in the area, right? So just look that where there is less number of physician. So around 1 to 2 is okay. If suppose I am living in Vashi, the population of Vashi would be around 5 lakhs. Okay, not that much, but 2 to 3 lakhs, around 2 lakhs. So if we have in Vashi, there are several sectors. So if in every sector there is at least one physician nowadays. But if you have like around 1 to 2, that's okay in particular. And maybe if you have nearby your home as well, then it's your priority. So it's never about that physician have to search for the good place. They can set at any point and build their practice over a period of years. Because how you communicate to the patient, how you treat them, and how much effect or output you patient will see from you, that will help you to build your name. And as I said, one more thing, the practice or degree won't even suffice. You should have that brand value. So start creating content in any form, either on LinkedIn or Instagram or YouTube, whatever you like, because people see that, and I think jo dikhta hai wahi bikta hai, right? We all heard about that. So make yourself more and more visible, then only you will be able to represent yourself.
So what would you say is do you think is the skill set that is required by a physician to run a successful clinic, to become a brand basically?
Yeah, to become a brand, first of all, you should have a very good skill about communication. Private practice works only on how you talk, how you convince the patient that you are right doctor to him. First of all, and that doesn't mean that you have to tell the patient that I am right doctor for you. That means that you are checking patient thoroughly. Starting from the entry of the patient, you are greeting him properly. You have kept good reception people. Patient is entering, you are listening to the symptoms properly, you are writing them down, you are asking for the past history and all those details, what we have learned. So the good physician or the great physician is someone who listens to the patient, right? Once you listen to the patient and then looking at the finances of the patient, looking at the patient's preferences, that how much he wants to pay or how much he is earning, I think then on the basis of that you should investigate and give maximum benefit to the patient in the lowest possible amount. So that will help you to build good practice for longer period of time. Because if you're someone who has worked to the corporate hospital and you have a habit of doing 10 investigations, that never will work in the OPD practice. So in OPD practice, you have to be very precise. You have to even prescribe very few medicines to the patient, because even if you prescribe for 5 days, patient is anyway gonna take only 2 days medicine. So rather than that, you just tell that 5 दिन का नहीं 2 दिन का ही लिखा है, पर आप अच्छे से लेना है. इनफैक्ट इफ इट्स नॉट एंटीबायोटिक्स आई एम टॉकिंग अबाउट, इफ इट्स एंटीबायोटिक्स यू हैव टू एक्सप्लेन द पेशेंट अगेन दैट एंटीबायोटिक रेजिस्टेंस हो जाएगा, आपको 2 दिन नहीं, आपको पूरा कोर्स कंप्लीट ही करना है. सो दैट्स वेरी इंपॉर्टेंट. कम्युनिकेशन, listening to the patient, and giving the patient what they want. That's gonna help you to build successful practice. And as I'm saying, if you have a good communication skill, start creating some videos, etc., etc. Because once, suppose just I want to go to the gastroenterologist, right? And I have one gastroenterologist who is very senior, and I have one gastroenterologist who is very young, I have seen him 100 times. I will obviously go to the gastroenterologist which I have seen 100 times, because I am familiar with him, right? Even if he doesn't know me, I'll just say, doctor, I see your videos. Then he'll get happy, or maybe he'll recognize me. Okay, yeah, right. I have explained that. So, aapko to pata hi hai, maine ye bola tha. So that helps, really helps.
How much do you think is required to start up a clinic in a metropolitan?
In the city like Mumbai, if you're just renting the place and if you're looking for a good setup, I think Just to get the place, just to get the rental, you have to give at least deposit of 3 months.
But
That's around.
that depends on how much is the space.
Exactly. So it depends on the space. If you're
So
just taking
what
around
is the space required?
500 to 600 square feet, that's required for one examination room, two OPDs, and one reception, small reception. So 600 square feet is decent to start the OPD from scratch. And for that, in the city like Mumbai, you should have at least 5 to 6 lakhs as a budget as a starting. I'm just saying because medicine is not the branch which will require lots of instruments, right? So you just need to have your BP apparatus, glucometer, SpO2 meter, even one saline, etc., and all those essential instruments, one bed for examination. So all this stuff with including the property, etc., so would cost around 5 to 6 lakhs to start okay practice. If you want to go premium, maybe 10 to 15 lakhs to start decent practice as a physician.
So basically, if we go to a two-tier city, automatically it will come down to half.
Exactly. Yeah.
So there's a lot of things that are required to run a clinic successfully. One of the things is that it needs to have a tie-up with the local labs, a radiology lab, a pathology lab. What are the business side that happens in these labs?
So most of the times what happens now, the
I already know the pathology side of it. Dr. Ranjit has explained to us.
Yeah.
I want to know the physician side of it.
okay.
What's the commission basically that has to be given?
So commission, I would say very honestly, the lab technicians are more richer than the person who is starting practice. So lab technician and even pharmacist offers the physician space. They say the doctor, we will give you space. Just come and sit over here. You practice on your own and just do whatever investigation you feel right of, and you earn the profits from the hospital. We will earn from the profits of the labs and the pharmacy. So that's the situation currently. And suppose now I've started my own practice, I've started my own lab as well, I've started my own pharmacy as well. There are two options. First, either tie up with one of the lab, give them. So obviously it will be a 50-50 commission basis, like whatever the profits are, you will get 50% profit of that, because the hospital, that lab is not tied completely, right? They don't have to use different resources at your place. The lab samples are anyway gonna go to that lab. So you can earn 50-50 commissions in that. And when we talk about the pharmacy, again, it goes in the same way, depending on the what different sort of medications you're using, if they're generic, if they are branded. So depending on that, there are again different things. So I'm not very much aware about that. But some people I have known have their own pharmacy as well and keep pharmacists for the job, and that helps them to get some benefits through the pharmacy as well.
A lot of medical representatives come to physicians, and they tend to get a lot of gifts also. So does that sway the mind of the physician to prescribe those medicines?
No. So that's a very controversial question, to be honest. Recently, the government guidelines says that you cannot directly gift the doctors, etc., and to ask the prescribe the medications and all. So right now, the situation has changed to the grassroots level as well. So what MRs do now is take events of the doctors. So they will not directly promote. The brand will take event for the doctor, and in that event, different people will come, will guide you, teach you, and tell the uses of the medicine or the product they have, or the molecule what they have made medicines from. So that's forbidden from the government itself. But yes, if you do good amount of the sales of pharmacies and all, companies get happy, maybe they can gift you as well.
Okay, Vishal, for the last question of the evening, again going to the educational segment here. So list down the top 5 specialties which you think are going to boom in the next 10 years. It can be any specialty, not just limited to medicine.
Okay.
And if you're going to list medicine or surgery, you have to give us the super specialty name.
For surgery, I would say plastic surgery is going to get very high in demand. Then in medicine, gastroenterology, because the GI issues are very high in amount now, even the bariatric GI scopies, etc. Then when you talk about endocrinology, again, obesity, diabetes, thyroid, this is going to get very high. Cardiology will always be high demanding. Talking about the fifth, that is neurosurgery, what I feel will have a very high demand, and the urosurgery as well. Urological issues, BPH, etc. Considering the adult population in the India and the coming in few years, the amount of the BPH and all, urosurgery will also flourish like anything.
All right, Dr. Vishal, but the interview does not end right now. We are going to move to the rapid fire question round. So it's a very, very simple thing. You just have to give us some very good answers, very truthfully, and very spontaneously.
Okay, let's hope.
One moment when you felt I have made it.
So the one moment is when I was in my residency and we had a patient of dengue encephalitis. So that patient was in ICU for almost 4 weeks, and we used to take care of him. He was not understanding anything, but I used to talk to him just like Sanjay Dutt in that Munna MBBS movie. And then eventually, after a few period, like 2 months, he got better. He started talking and he said, Dr. Vishal, I used to listen to you every day. You used to give me so much of motivation. And then 6 months ahead, he comes walking to me, brings his wedding card and his father with sweets. That thank you, Vishal, for reviving our patient like that. So I think that was a moment when I felt like yes, I am sincere to my job.
Very sweet. Most interesting case you have seen till now.
So I have seen one case recently where there was a brain abscess, and we had several theories on that. And I had a brush for the patient, the makeup brush and all. So obviously it's contaminated, and that had MRSA. So that was one of my theory. I explained to my guides and all that there is a brain abscess because of the brush that patient is using, because she had a pimples. So from pimples around the nose, that's a dangerous area of the face. From through the cavernous sinus, the infection must have got to the brain, and from there the brain abscess would have got. So we managed with the MRSA antibiotics, linezolid, etc., and vancomycin, and she got better with that. So that's just a theoretical.
Proper
not
house MD moment.
exactly. I had made real on also that, but yes, that happened, and I think that's a very great, very interesting case.
Fact or myth? Physicians tend to get heartless because they see, death all around. Fact or a myth?
I think that's myth. That's myth. Yes, physicians get blunt because they can't show their emotion, but internally they are, just like any other person. Because if you show your emotions to your colleague, or if you show the emotions to the patient, they feel that he's guilty. We can't show that guilty emotion to the patient. And in fact, inside we are very guilty. We never sleep if something bad happens to the patient. But yes, we have to act like that. Otherwise, our juniors, the patients' relatives will never get, that confidence in us.
Any moment in your life that you regret?
So yeah, there were few moments, and I think one of that was during my residency, where I felt that maybe I am not doing good with this. So I had mental breakdown. I took like 7 days break, as I said. So in that 7 days, I went home, and I thought like I'm gonna leave the residency now because it's taking mental health stress on me. I told my parents, and they said, "Beta, this is what you wanted throughout your life. If something bad happens in your life, that doesn't mean that you change your path, right? That means you just tackle, or just duck the bouncer." So that's what I did. I thought like, now let's get back to the hospital, say sorry to whatever mess I've done. I said that and went back, and I think that was one regret I did.
Happiest moment in Dr. Vishal's life?
Happiest moment is today when when I'm shooting a podcast with you, and second happiest moment, I would say that's the first happiest moment. This is the second. I guess when I got to marry my wife, we were together since our MBBS days, and we got through a lot of troubles because it's a kind of love marriage. So parent finally agreed, and the day I got married was the one of the happiest moment. Apart from also this episode.
That's very sweet, Dr. Vishal. So thank you so much for a scintillating conversation today. We came to know everything we need to know about medicine. So thank you so much for that.
Thank you so much, and I wish all the best to the audience as well. If you want to do medicine, just tell yourself today that I'm gonna work sincerely over entire of my life.
Thank you for the very inspirational words, and thank you guys for watching today's episode. I believe everything you wanted to know about medicine has been covered in the last 1.5 hours. And trust me, I did not come to know how the time has passed. A fabulous conversation, a great guest, and superb audience. Thank you so much. And before you exit, do not forget to like, share, and subscribe. Thank you so much, and God bless you.